So welcome and happy Friday, everybody. My name is Ryan Rohde, and I will be the facilitator for this support series that's titled Changing Times. This is a regular discussion series offering collaborative connection, consultation, and support. Our goal for this webinar series and experience is quite simple. Basically, during these rapidly changing times, it's important to have connection to peers and to have a safe space to seek support to manage the challenges that many of us are experiencing. And just C4 Consulting has always been committed to providing a trauma-informed connection for discussion, hope, and support through peer collaboration. And I just before we jump into the actual discussion and webinar, I want to go over just a couple of, I want to go over the agenda, the etiquette and guidelines briefly. And an introduction, we'll begin with an introduction of all of our panelists, followed by an invitation for all of you who wish to join in a brief grounding exercise. We'll then open up the discussion portion, which we'll dedicate the majority of the time to. And we'll conclude the discussion and spend a few minutes reviewing the highlights from the webinar, some areas of interest, and then we will end up closing again with another grounding exercise for anybody that wishes to join in that. We'll be utilizing polls during the open and closing to encourage your active feedback. And we will share those results live throughout the process and just go over what we're seeing from those polls. Now for the very fun etiquette and guidelines for this. I'm sure many of you are already aware of it. And a lot of us, may be familiar or likely to get zoomed out, another Zoom meeting in the day. Let's quickly just review some of these guidelines. I'll try to make them brief. But be courteous, genuine, and respectful with your investment when you're asking questions. Be an active participant by asking concise questions and listening openly. And keep calm, relax, and provide your feedback with integrity. And then in addition to the questions submitted during your registration process, new questions and comments can be submitted through the Q&A, and our moderator will select and forward those questions to be addressed by our panelists. We will certainly do our best to address all of the questions as they come in, and the ones that we may not get to today, we'll certainly have in our continuing discussion and continuing of the series. And then of course you can reach out to any one of our panelists through our website, and all of their emails and bio information is all linked on there. And I believe we will have a link in the side there for everybody to look at. And now briefly, just want to introduce all of our panelists so they don't just seem like random folks sitting on a screen for you. We've got with us Adina Bank-Leese, Mary Woods, Lisa Jane Vargas, and Dr. Leah Brick. The support team members include Jesse O'Donoghue and Jonathan DiCarlo. They are the two C4 images you see there. They will be handling all of the back-end information and submitting of the questions, etc. And before we begin, we would like to start with a grounding exercise. And a poll will be coming up shortly for everybody to answer before we begin that grounding exercise. And for this poll, just answer it openly and honestly with everybody, and we will acknowledge the results as they come in. give everybody a few seconds here just to kind of wrap up this poll. All right. So we've got the poll results here, and it seems as though mental health has dominated this poll here. So I'm looking forward and curious to hear more about this and have our panelists walk through each one of those and discuss mental health throughout these times. And with that, Lisa Jane, would you please guide everyone who chooses to participate through our brief grounding exercise?
Yes, I will. Thank you, Ryan, and welcome everyone. So glad you're here today. And speaking of mental health, we want to offer something for our mental health today. So before we begin our time together, we want to offer a pause for this Friday. We believe that taking some time to breathe, get grounded, reset can help us in these changing times. This is an invitation. It's just for a few minutes. And what I'd like to introduce to you is it's called box breathing or box breath or 4-count breath. So I'd like to invite you to, whether you're sitting or standing, get yourself in a grounded position with your spine nice and tall. And your shoulders relax down from your ears, and if you're interested in close your eyes. Just go within for a moment. And I'll explain what box breath or 4-count breath is, and then I'll take you through a few rounds. So we inhale for a count of 4, hold breath for a count of 4, exhale for a count of 4, and then hold for a count of 4, and then repeat that cycle again. So I'll take you through with your eyes closed in your seated or standing position. Breathe in, 2, 3, 4. Hold, 2, 3, 4. Exhale, 2, 3, 4. Inhale, 2, 3, 4. Hold, 2, 3, 4. Exhale, 2, 3, 4. And hold, 2, 3, 4. One round. Take inhale, 2, 3, 4. Hold, 2, 3, 4. And exhale, 2, 3, 4. And hold, 2, 3, 4. Now take one deep breath, inhale. Maybe exhale, let it out, all that exhale through your mouth. Any stress, pain, anxiety, fears. One more time, deep breath in. And exhale out through your mouth. This is a great practice that you can do anytime throughout your day. You start feeling some anxiety, helps bring some relaxation and calm, and helps get us grounded. So with that, thank you everyone, and we'll send it back over Ryan.
Thank you, Lisa Jane, for guiding us through that. We'll now begin with the discussion portion and answering some of the questions. And we will begin today with the following question, which is how do we deal with all of the different stressors we are experiencing during these rapidly changing times? And with that, I'll leave it up to and open to the panelists to kind of discuss that first question.
Thanks so much.
Here.
Go ahead, Leah.
Thanks, Adina.
Yeah, of course.
One of the things that I have taken on just in the last 4 weeks is I noticed that I really am sitting around at my house a lot and really obviously since March. And that's to do what Lisa Jane just had us do, and that's doing some meditation and just quietness. So yesterday, for an example, I take a walk every night. Part of doing that to just get some energy after I've been sitting all day and sitting in Zoom. And so yesterday, rather than listen to an audiobook, I did a senses meditation walk and just really paid attention to my hearing, what I was hearing, what I was seeing, what I was smelling, what I was feeling, and just pay attention to every single part of all of those senses for myself, but also what was happening around me. And that was really amazing for me to recognize just how the grass smelled, how the trees smelled, what I was hearing, all the different voices, and I slowed my walk down. And so that's been very helpful for me to deal with the stress of sitting in Zoom calls all day, everything that's happening around us, homeschooling for the last couple months. So I don't know if that fits for anyone else, but that really was great for me yesterday, and I'm going to add that to my practice regularly.
Thank you, Leah. That's awesome. And it goes along perfectly with what I wanted to share with everybody, is that being a 12-step person, some of the slogans from 12-step program have really been helpful for me through this. And the serenity prayer, I have to say, has been a mantra for me, so that I really can look at what is my part, what do I have to accept in terms of the uncertainty, what can I do, what actions can I do, and what do I have to let go of. So things like first things first, easy does it. And my spiritual practice has gone through the roof because of this, so that I can stay present, that I can stay with myself. And I always like to walk my talk with my clients. And this is what I ask them to do when their life is uncertain, which is why they come to me, because their life is uncertain. So just as much as I can encourage everybody to stay present, do what works for you, and make sure you're getting out and moving your body, because being sedentary for me is pretty much a death sentence. Thanks.
I would echo what both Leah and Adina have shared. You know, I think it's important for me to look at this in terms of an opportunity. What am I being given here, as opposed to what is being taken away? So the opportunity to dive more into my faith and my spirituality, to really practice what, as you're saying, Adina, what we preach, right? Now we have to do it too. And I think that it's given me a better understanding of how difficult it is to change, and to have to accept new ways of coping. And so I think the other thing for me that's been very helpful is I just say how I feel. I get zoomed out, and every day I pray that this isn't what we're going to come to, are these flat screen interactions, because I miss being with people, you know. And I try to take a walk during the day when other people are walking in the neighborhood, just to have that human connection. So, you know, this too will pass, and one day at a time.
Yes, along with what everyone has shared, for me, I've used the tools of some of my support groups that I'm involved in, and what I'm noticing is there's these waves or ebbs and flows of acceptance and not acceptance, and yoga plays a big part in my practice with what I'm experiencing, and to help me be present and slow down. My tendency, and maybe some of your experiences too, is to want to fix this and get a solution at an end. And what it really comes down to is, like Mary said, is acceptance and being in the day, and what can I do today? And that translates out into everything I do, my work, people I'm interacting with, my family. You know, if you're a part of a group practice or a treatment center, you know, it starts with us and then just ripples out, you know, to those that we interact with for the day. So I think that's part of my message here today is, you know, taking care of self to be able to help others and in these trying times.
And I see a question about, next is about, given the COVID-19 protocols in various states, when and how do we return to our offices and practice safely? And I know that that's been a discussion here amongst my colleagues in Tucson. And in my office in particular, we have specific guidelines that we wrote up. We make sure everybody knows that they need to make sure they don't have any symptoms, that we have hand wipes everywhere, that we have, excuse me, that we have hand sanitizer. We need to sit at least 6 feet apart. The therapists are making the decision with their clients whether they're wearing masks in the office itself. In the waiting room, absolutely, but in the office itself, they're making those decisions and actually making decisions based on the clients as well as their own safety about when they return to the office and who they actually see. And I know for myself, I am only seeing one person right now every other week in the office. Everybody else is on telehealth. And in Arizona, our numbers are spiking. And so I am continuing to let my clients know that telehealth is it for a while. And the last thing I'll say is I've really been surprised about the deep work that people are doing even on Zoom. I did not expect it, and we're adapting, and people are able to be contained as we're practicing that in sessions, and I'm really, really hopeful about that.
And I'll just pick up where Dina left off, and of course I'm in Georgia, so every state's different. Every state has different guidelines on what they should be doing, so it's important for anyone to check what's true for your state and make sure that you're following those guidelines. And the other thing I think it's really go along with stressors that we were talking about a minute ago is to honor where you're at. And so for me, I work from home. And so I don't have an office that I have to go to, but I still am practicing safeguards when I'm going to the grocery store or wherever I'm going out to, eating in restaurants, paying attention to that and acknowledging the grief that I feel with things being so different. And also the joy of, well, I haven't been in person with lots of people, but I do have this forum. I do have this. I have Zoom. And sometimes it is like sitting in someone's office, because if you're like me, where you work from home, you don't get to go to people's offices that often. So it's a joy to see all of you in this forum for a little while, even if it is a flat screen and we're not hugging, which is again something that I'm grieving over. I'm a hugger and I want to be able to demonstrate that, how I care for folks. So there's so many things to think about. The stress of what it's like to go, somebody wanting to do something different than I'm going to do. We have that in our own house. We had a discussion last night. My husband wanted to eat in the restaurant. I didn't want to eat in the restaurant. So how do you manage that in your own home and follow the safety guidelines and acknowledge each other's feelings? So I think that's really important.
I think flexibility right now is really crucial for all of us, and really being able to listen to what our clients and our coworkers are saying in terms of social distancing and whether you wear a mask or you not wear a mask, and be respectful of what other people are experiencing and what they're thinking. I think I'm in New Hampshire. We're opening up. We have not been hit as hard as a lot of the other states, but we still have, you know, new cases being reported every day. And, you know, I think we just have to really look at what our own risk factors are and what our comfort level is, and then stick to what you believe is best for you. I don't know that there's any right answer. Every state has their own guidelines. And I mean, even going from, you know, Maine welcomes people from New Hampshire and Vermont, but everybody else, they're asking for proof that you've had a COVID test. So I think, you know, it's just, you know, if you live in a big state, you don't have the problems as you do when you have like these little states that are right next door to each other where people flow back and forth all the time. So, you know, be flexible and mindful, because every day it changes.
Yeah, I just want to echo all that has been said. And, you know, I'm in Arizona and it's not that great here. So, you know, businesses have opened and closed already again. So it is just case by case. If you're in private practice, you know, I am not a clinician, but I have lots of friends and colleagues and family members that are, and just finding that balance of maybe just going into their office where there might not be other people around, but having a session in their office just to get out of their own home for a minute. So it really varies. I think there's one right answer. So.
I think there's a question around how do we manage the grief that we're feeling. Leah, you talked a little bit about it a minute ago, and you know, grieving is part of the human experience, but it's something that most of us don't get a lot of. We're not taught how to grieve. We're taught how to move on, right? How to suck it up and move on. And I think grieving is such a wonderful process, and if we can honor that process for ourselves, I think it helps with the stress. I know that, you know, we weren't allowed to go into hospitals. You know, my ex-husband was having surgery. It was pretty significant, and none of us could go visit him. And, you know, the thought of, well, what if the worst happens and then you don't get to say goodbye? And there, you know, we all have stories of folks that we know that have experienced that, especially our elders who are in nursing homes. And I think being able to just acknowledge that we're grieving a lot. We're grieving our relationships. We're grieving our workspace. We're grieving our community. We're grieving our just our society is grieving right now. And so being mindful that there are stages of grief that most of us probably remember, but in terms of, you know, there's the denial, the bargaining, the depression, the anger that happens, and then ultimately coming to terms and accepting what we're grieving. And I just think it's important to have those conversations and really talk about grief and look at what it is we're each grieving, because we all are.
I think that's so important, Mary. You know, early on in this whole crisis, I didn't even realize I was grieving. I couldn't figure out why I was feeling just off. And some days I would cry, some days I would be incredibly irritated and not even recognize that was grief. And so not only do you have to acknowledge it, but you have to recognize it and know that it's happening. And we don't do that in our society. It's not one of those things, as you said, where we're told to move on. Oh, so-and-so died, and aren't you over it yet? Or, you know, you've lost this relationship. Aren't you over it yet? It's been XYZ time. No, it's been 3 months. Aren't you over it yet? Aren't you not irritable? Why are you so grumpy? Well, I'm grumpy because I'm sitting on 7 Zoom calls a day. I don't get to exercise, or whatever it is. But, you know, yes, you have to acknowledge it, but you also have to know that what those feelings are that you have, kind of dig a little deeper and say, is this grief, or am I really irritated about something else, or am I really sad about just the situation that's going on? Just my thoughts.
Real quick, I just wanted to jump in before we get to this next question here. I really do want to encourage the audience, please use that Q&A and ask any question openly and honestly that you may have. We do have some additional questions, obviously, that came through from the registration and things like that, but please, by all means, use the Q&A to really answer anything that might be on your mind, and any one of our panelists would be excellent at helping you identify that and answer it. But we can jump into the next question now.
Okay, so my understanding of the next question is, how are we discerning between grief and loss versus PTSD or traumatic stress, both in ourselves and our work with clients, coworkers, families, friends, whatever? And one of the things I've taught over the years is that the healing process from PTSD is a grieving process. And so I think it's part of, and PTSD, what we know, if it's post-traumatic stress disorder, there's intrusive thoughts and things from the past come back. And sometimes it feels like what was past is actually happening right now. And so for myself, I know that when I'm noticing that my reaction is bigger than what the situation is in the moment, that's about my past. And it's been very helpful to do what we did right at the top of the hour and talk about slowing down and taking quiet time, which is when some of these awarenesses come for me, and how I teach people to start having those awarenesses and start being able to be in their body more and have their body be a safe enough place where they can touch in and tap in and be able to identify the sensations, as Leah was talking about, or irritability or sadness. So that's kind of how I look at it. And a client of mine, I'll just share very, very briefly. She lives by herself and she's having all kinds of stuff come up regarding old traumas. And she actually had an urge to drink yesterday and reached out to me to talk with me about that. And so that's one of the pieces of going back to old survival skills that we do when we have post-traumatic stress and any kind of stress.
And from my training and experience, as a yoga therapist, I tend to lean more toward releasing that charge that we get from trauma, that neurological charge held in our body, to release it somehow. And there's many ways we can do that. Breath is a great way, the way we started this today. But any kind of physical activity, even reaching out and just maybe setting some goals for yourself of, I want to build my network. I want to start reaching out to people in a different way so that you can maybe have more conversation. But to me, this, the grief and loss and the trauma and the PTSD combination that we're experiencing from a physical perspective, and finding ways to release it, because I know from my own experience, holding it in and stuffing it can come out in different ways and sideways and maybe more harmful ways to myself and to others. So that might be a whole nother topic, ways of physical release from PTSD or trauma. But I'm a big fan of meditation, any kind of yoga practice or physical fitness and exercise, sports, gardening, anything that can help me maybe put myself in a different mind frame or state, so that I'm not always thinking about that grief or that issue. So that's kind of what works for me.
think it's really important to have a support system that you can talk to and reach out to or text to. One day I was feeling very isolated, and I just went through my contacts on my cell phone and started texting, "Hi, how you doing?" You know, and then the rest of the day I was getting responses, which kind of helped me turn things around in my head, right? And I think that anxiety, I mean, these are anxious times for all kinds of reasons, and we need to acknowledge that. And that anxiety is happening because maybe our paycheck isn't as big as it we're used to, or we can't get to the places we need to get to, or we can't be with the people we need to be, or we need a new water heater and we don't know how we're going to pay for it. And I think that it's just really important to understand that these are anxious times, and whatever we can do to cope with our anxiety, I think is really important in terms of, it's all interwoven, right? As Adina was saying, this is all interconnected. It's not like we can just do one thing and everything's going to go away. So
I really appreciate what you're saying, Mary. And I know we have another question that takes us in a little bit of a different topic, and I'd like to address that. But first say that I'm hearing a lot of the questions we've had so far really coming into a theme of how do we do self-care in the time of uncertainty when we can get into so much fear. And, F everything and run, base everything and recover. Stay in the present, do what's in front of me, do the next indicated thing. Those are the pieces and the principles. Back to basics is what I've really been practicing and encouraging my clients to do, and my coworkers and my consultees, so that we're staying in the present moment and gratitude for what I have and looking at the opportunity, like you said, Mary, seeing it as an opportunity and a commencement for something new, and trying to be curious about and excited about what's going to be next. So Leah, since we haven't heard from you in a minute or two, could you go for the next question for us?
Yeah, so the question is, what are new coping skills or practices people have tapped into to reduce compassion fatigue and increase compassion satisfaction and happiness? And trying to think of some of the coping skills that I have had. Well, I'll tell you one right now is, so on Monday night, I'm doing things, I'm pushing myself to do things so that I am getting out of myself and what I maybe sitting back and doing nothing, forcing myself to help others. A cousin texted me on Monday night, somebody that doesn't talk to me very often, but she said, "Are you up for a social call?" And I really wasn't. It'd been a long day. I didn't want to call. I didn't want to have that conversation, but I chose to do it anyways because I knew if she was reaching out that she needed something. And we ended up talking for almost 2 hours on the phone, and I felt so grateful afterwards. One, that she had asked, but the other is that I had done it, because I learned that her aunt, my aunt's twin sister, had died. And my cousin is very close to her, and she really needed someone to talk to, and she doesn't have a lot of support like the two of you are mentioning. I am one of her supports. And so the fact that she asked out for me to do that was really important. And that's a new skill for me in some ways, because I have had to learn how to say no, but I also have to learn how to say yes when I really don't want to, when someone's reaching out. And so I felt really good, about doing that and taking care of her in her time of need.
for me, I'm not sure how many new things I'm doing. I think what I'm actually doing is practice what I've always preached, and really getting comfortable with that. And, we all experience this in different ways. And one of the things, one of the mantras that goes through my head every day, sometimes multiple times, is God won't give you any more than you can handle. You handle what he gives you today. And, you know, just trying to stay in today and, you know, just get through today and enjoy it. Find things to be grateful for. You know, the glass is either half empty or half full. I choose to say that it's half full. You know, this isn't going to last forever. And I think, and my hope is at the end of this, I'm going to come out a better person for me, a more aware person, more spiritual person. You know, this ability to practice all of those tools is, I guess, what I needed, right? Because that's what's been given to me. But, you know, I think I've really tried to just rely on what I know has worked for me for the last 40 years. So, open to new things, but just trying to, you know, do what I know works.
Yeah, as far as new coping skills and practices about reducing compassion fatigue, I think we're in a place of a different kind of compassion fatigue, meaning you might be working with clients, but now we have the extra fatigue of Zoom. You know, it's great in many ways, but there is a fatigue part of being on a screen all day, which kind of compounds maybe some other fatigue, compassion fatigue, or whatever else might be going on. And so for me, I might need to say no at the end of the day and do something mindless, and refresh, you know, and regroup. The other thing that I've been very mindful of doing is, you know, I don't know if this is true for a lot of you all out there, but I get 100,000 emails a day of, you know, all kinds of options to participate in. And I've been choosing some of them, like a book study or something else, ways to stretch myself and learn and just do something different. So that's a coping skill that I've been practicing for the last couple months.
And I love this question. And being a psychodramatist, one of the things that Dr. Moreno, who founded Psychodrama, he wrote a book called Who Shall Survive? And this was back a long time ago. Basically what he said is the foundation of psychodrama, which is only the spontaneous and creative will survive. If you get stuck in your old ways, not practicing your old ways, Mary, like you were talking about, but stuck in them, you're not going to survive and you're not going to be able to move forward into the new times. And so the definition of spontaneity in psychodrama is an adequate response to a novel situation. Just an adequate response. I don't have to be perfect about it. And to be doing some things that I either haven't done in a while, continue to do, or try out some new things to shake it up a little bit. And excuse me, one of the things that I've noticed for myself is that I slowed down a lot because I didn't work many hours that I had been working, I wasn't working. And there were a lot of feelings that came up. And one of the pieces that I've learned from that is that my workaholism really keeps me from dealing with some of the very difficult feelings that I have from the past, that are grief and loss from the current. And so when I'm slowing down, I am feeling them. I'm able to process them within my own therapy, with my support system. And that's been a critical, very, very critical piece for me to continue to be aware of that, which goes along with everything we've been talking about.
Adina, I love what you're saying about slowing down. I think that's one of the things I've realized about myself as well is the workaholism and just how easy it is because I work at home to sit at my desk longer hours than I really would. And because I was doing that early on in the crisis with this pandemic, what I had to force myself to do was get up and to stop doing that. But what came about as a result of it is what Lisa Jane mentioned, which is more opportunities coming my way to try new things, to do a book club. Now, I didn't do a book club, but to read a book that I normally wouldn't read. So I did that. Or to, my mother is learning how to play the ukulele. Which I think is fantastic. I mean, who learns to play the ukulele? And this woman is 84 years old, and she's decided in the pandemic, she doesn't have things to do. She still works. She's going to learn to play the ukulele. You know, I'm sewing more. So just slowing down enough. Cooking. How about cooking? I'm cooking so much more because I'm not working until 7 o'clock and then there's no dinner. So I'm forcing myself to get up and then go and cook and have this wonderful meal. It's the opportunities I think are there. And, you know, taking on a new project creates that vulnerable state, but it also can create some new joy that maybe we haven't experienced for a while. So I'm really enjoying that.
And if I can just jump on that just very quickly, there is a concept called post-traumatic growth that came out in the 90s. And that's what we're talking about here, is being able to identify and embrace the opportunities for shifting and changing for the better and deepening our relationships, which I know for my marriage, we've spent more time together, which sometimes has been irritating, but most of the time it's been very nourishing and deepening. And so let's look at it through the lens of post-traumatic growth versus post-traumatic stress disorder.
I'm so glad that you said that, Adina, because my concern is that sometimes we pathologize everything when a lot of what we are experiencing is normal, and that there are opportunities. You know, I started a book club with some of my friends from nursing school, and it's great because we're on Zoom and we're all over the country. You know, and we wouldn't have done that. We just see each other once a year, and so, you know, projects, you know, doing things that I have been on the to-do list for probably 10 years, I'm finally getting around to doing. And I just think that, you know, I'm sure most of us are going to come out of this with more skills and more self-confidence and more awareness of ourselves. I really think that that's maybe one of the reasons all this is happening, right? So we evolve more into who we are supposed to be, as opposed to just working and giving to everybody else. And now we have an opportunity to give to ourselves. So that's how I kind of want to look at it for me.
Yeah, that's a really good point. I love looking at the opportunities, and there are positives in this. It's so easy to look at the negatives and the heaviness of this. But for instance, I hear people all the time saying, I get to be on an AA meeting across the country that I used to go to when I lived in this place, and now I get to, you know, participate in this meeting with some of my friends from where I used to live. Or, you know, the conferences in our industry have pivoted beautifully. A lot of them have pivoted beautifully, and we have, you know, C4 events that are coming up that are going to be virtual, and we're doing it in different ways, and really looking at, oh my gosh, there's some really good things about this, you know. But there is a question about, given that we are connected with physical distance, how are people thinking differently about returning to connections in new ways without being in fear? And so even though we have those, you know, maybe hopes of going back to the way things were, and I'll just use the conferences as an example, it's probably going to be different, you know, like with our schools, you know, it's going to be different. So, you know, hybrid, you know, some of this and some of this. But I really have a lot of hope in us that we will figure it out. I think, just like I mentioned before, we're being stretched. We are being stretched in ways to expand our views, our everything, to how can we still be okay and do it differently, you know? So
I don't think it's possible. So the part of that question is, how do we do it without fear? I don't think we can. I think we have to acknowledge that we have the fear and then figure out how to make it work, and to honor our own selves in, okay, how do I need to do it different for me? And acknowledge that I have the fear, because I don't think I can do it without it, but how can I do it with it? How can I step into it and know that the fear is there and still take care of myself without discounting what other people feel or what I feel? You know, so I think it's impossible, quite honestly, to do it without the fear. I don't think it's possible.
I would agree with you, Leah. I think that fear is part of it. And I guess it's coming from my nursing background, but this is not the first pandemic that our society has experienced. If we think about tuberculosis, we think about polio, think about 1918, right? These have been tremendous illnesses that affected a great deal of our country, but we were able to find a way to treat them and then, in some cases, eradicate them. And my belief is that that will happen with this too, and that we will find a way to medically treat this. We already know more than we did 4 months ago, so I would like to just think that this is going to evolve, and we're going to learn from this, and our society hopefully will have a better public health system as a result of it. So.
Well, I really appreciate what everybody has shared about that. And I just go back to, I don't know if there are so many specific answers to these questions. It's about where we are, and are we willing to continue to stay open to that adequate response to a new situation right in front of me. And it's evolving, and the creativity and spontaneity continues to evolve, and we will come up with, with answers. And I also want to really address this last question about, I relate to this question 100%. I very much want to talk to my clients and people around me about hope, and yet I don't have a whole lot of hope about our society. And I would take it about human beings to begin with. And sometimes that drops for me a lot. So, what do? What I do is basically go back to what we talked about most of this 45 minutes or so, which is my spiritual practice, my quiet, my going into nature to help to regulate my nervous system. And when I regulate my nervous system and I feel connected, and nature is a big way that I do that, 12-step meetings are a big way that I do that, walking, etc., I have some more hope. And I am really working hard to practice those gratitudes and be in that physiological state so that I can get out of the hopelessness that shows up, that I think is also normal, just like we're saying the fear is normal. I just want to normalize and validate that all of this is going to be happening, and to try to get out of any feelings, I think is exactly opposite of what we want to do.
There was, when as a group we started talking about doing this a while ago, and so much has happened in our society just in the last month, right? And I think we would be remiss if we didn't acknowledge that, this is an inflection point for tremendous social change. And I remember back in 1968 when we had all kinds of turbulence. We had assassinations, we had the Democratic National Convention, we had Stonewall, and it seemed like we were going to implode in 1968. And somehow we came out of that, and there were some good things that came out of that turbulence and all those conflicts. And I'm hoping that this is the same kind of time in our life, that things are going to change, and we can use this as an opportunity to listen to other people's perspectives and really understand, you know, we have a lot longer road to evolve to get to what it's in our Constitution and our Declaration of Independence, right? We all have the history behind that, but you know, we can get to that. We want to evolve to a more perfect union. And I think that we have the ability to do it. I want to believe we have the ability to do it, because if we don't, I will move to, I don't know where, some warm island somewhere. But, you know, I think that goes back to having hope and having a spiritual practice and belief that, you know, there's a higher power here that's guiding this. And we just have to get out of the way and follow the guidance.
Don't you think part of that, though, Mary, is it's about compassion, and it's about compassion for self, it's about compassion for others. So thinking about both of these, you know, how do you have hope? You're encouraging your clients to have hope, but you don't have much hope. But that's self-compassion. You know, in the program, Adina, we talk about fake it till you make it. And, you know, sometimes I have to do that. I have to fake it till I make it. I did that a lot in my early sobriety. I just had to look at other people and know that they were doing well. I could get there and have compassion for myself, but also compassion for our society and the walk in someone else's shoes and what that feels like, and change my worldview so that I'm seeing things from someone else's worldview that I don't see as a white woman in our society. And so how can I be compassionate towards your story and take care of you and me at the same time?
Well said, Leah.
Yeah, very well. Thank you, Leah. It's what we're experiencing, I think, is helping us open conversation. If we're willing, you know, maybe developing our compassion part of ourselves. Sometimes I think of what we're experiencing collectively as like an alcoholic. Have we met our bottom yet? You know, are we at our bottom, you know, to start our healing process? I don't know, but that's kind of what it feels like sometimes. Because like another thing. So I think, you know, compassion starts with ourselves, and having compassion for ourselves, and then and being open and willing to express that with anyone, you know. This is definitely an evolution. We're in a little evolutionary process right now to hopefully transform into something else and get sober, if you will, if we take that analogy. So, but anyway, thank you all.
And thank you so much, everybody, for that discussion. Jonathan gave me a term that I really, really like, and I'm going to stretch it a little bit. Rather than, you know, cultural competence, Leah, you were talking about, you know, as a white woman and listening to other people's perspectives. And he talked about cultural humility versus cultural competence. And Jonathan is our CEO of C4 Consulting, and very wise man. And so I really, really liked that, because that's what it feels like to me. I am, you know, I've traveled a lot around the world. I really appreciate different cultures, even within the United States. But I'll be honest, I live in a white world here in Tucson, in this part of Tucson. And so I am sheltered. And having this conversation, Lisa Jane, what you talked about, to me, is about cultural humility. To have things be overt. And that's, again, psychodrama is make it overt. Whatever's intangible, make it tangible. Whatever's not said, speak it. And that has been so critical in my connections with coworkers, in my work with clients, in my marketing, networking, managing, consulting, and all of that. Let's really put it out there. And so that's the piece that I want to kind of plug, not with a whole lot of answers. But I will say one last thing is that with a colleague of mine, she spoke about a session she had with an African-American woman who was just sobbing about what was going on racially. And my colleague really, really assessed it and started to talk about her white privilege in that session. And the client toward the end of the session said, "Thank you so much, because now I feel safer with you. I could not have felt the feelings and the grief that I feel without you acknowledging that." So I think that's really, really huge. And I would say even I'm looking at racial humility. So I think, we're about at the time to start closing it up, Ryan. So I'm going to turn it over to you. And thanks everybody for being here, and my wonderful colleagues for such a great discussion. Hopefully people gained some things from this, and really keep talking. And we want to keep talking with you as well. So Ryan's going to mention some opportunities here.
Yeah, absolutely. So thank you. I want to thank everybody for your consideration and investment with us today. We really appreciate it. Together, if we stay connected and support each other throughout these times, we hope you find kind of our time together collaborative, safe, and supportive. That's really what this is about. Going forward, we'll continue to evolve this support series based on kind of the questions that you have and anything that may not have been addressed, and we can kind of work on the continuation of the series from there. And please let us know if there's anything that we can do in the meantime to help support you. And you can email any of your feedback to us directly through any one of our bios on the C4 Consulting website that we'll have up in the chat soon. And we'll do our best to just kind of answer and guide you as you need it throughout this time. And with that, I just want to kind of, we're going to close with a poll here, just kind of one last closure poll that we'll use to kind of put into our next webinar in this series. So if you could please just answer that honestly and openly, that would help us greatly. And I will kind of go over those results as we get them in.
And as we're waiting, if it's okay for me to say a couple of things as people are taking the poll, I want everyone to know that as a group here, one of our commitments and our vision is to be able to offer continued support to you, to our community. And it's really a piece of what we've been talking about today, and how we're giving back and doing this spontaneous piece about how do we move forward, because if we're not a collective and we don't discuss it, we won't know.
Okay, excellent. Well, it looks like we've got the poll results back, and that's hugely helpful. Looks like a lot of folks were enjoying the kind of dialogue of today's discussion, so we'll continue that and build off of that. So we really appreciate your input there. And before we adjourn, let's take a moment for those of you who choose to participate and end it with another brief grounding exercise by Lisa Jane.
Sure. So thank you, Ryan. Just wherever you are, if you're sitting or standing, plant your feet into the ground, just as if they were roots of a tree or a plant. Just plant into the ground. Feel that steadiness, support. And take a deep breath in, and as you're breathing in, consider that you're inhaling love. When you exhale fear and let it out. In your mind, maybe just set an intention for yourself today and take that with you through your day. You can also come back to the breath anytime. Just remember, it's a grounding tool for you. Gently open your eyes, shake your arms and legs, get some movement. Pull your shoulders. And thank everyone.
Thank you, Lisa Jane.
Yeah, thank you for guiding us through that, Lisa. Just wanted to quickly just kind of close out here before we all leave. I really do truly want to thank all of the panelists and all of the participants in this webinar today. We really appreciate it, because the more we can all stay connected and have these open discussions and answer anything that, you know, might be what we're all feeling across, you know, the US is really just, it's important to us. And, you know, please reach out and stay connected to any one of us for any guidance you may need along the way. And truly thank you all for your considerate and compassionate responses and support for the panelists as well as the audience here. And, you know, with that, just please be happy, be healthy, safe, and well, and enjoy the remains of a great Friday and have a wonderful weekend.
Bye, everybody.
Have a great weekend.